Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about how to best protect yourself and your family this Thanksgiving as COVID cases continue to surge. I'm here today with Dr. Ginny Bose, St. Luke's Health System Director of Infection Prevention. Thank you so much for joining us.
Hi, Lindsay. Thank you so much for inviting me.
Well, last week, the CDC issued updated recommendations for Thanksgiving gatherings, discouraging travel after more than 1 million new cases were reported in the U.S. over the span of 1 week. Whether you're hosting or attending a small gathering or have other plans, we'll be talking about ways to reduce the spread, as well as high versus low risk activities. Well, Dr. Bose, as mentioned, the CDC is now discouraging travel for Thanksgiving. Can you explain the risk of traveling, given what we're seeing across the country?
Yeah, the chances of people getting exposed to the virus are really very high right now. The last thing that we want is for families to get together and end up hosting a super spreader event. We are anticipating that the numbers of cases will go upward. So it's really going to be important for people to think about the different strategies, which are very simple, but the different strategies that they need to put in place to minimize their risk of getting the virus. Hand washing, wearing a mask, and I might add the importance of wearing a clean mask, avoiding touching your mouth, your nose, hands, and the social distancing is going to be really important.
And for those that do travel, are there any measures they can take to help reduce the risk?
Absolutely. Think about the types of travel. If someone needs to fly, then think about the steps that are necessary for boarding or deboarding. Some people might be using a bus, whereas they want to allow lots of space between the seating. Then if they're coming by car, you want to think about the times that you need to refuel or that you have those bathroom breaks.
Okay, now if someone has self-quarantined for 14 days up to Thanksgiving, is that enough to keep family members safe who may be at higher risk?
You know what, that's a really good step in the right direction. The quarantine is really, as long as everybody is practicing the quarantine, is probably one of our best ways of preventing the transmission.
Okay, and what advice do you have for someone who may be hosting a gathering? Is there anything that they can do?
Well, this is the time for those party planner extraordinaires to really show their skills. So thinking about the guests that you've invited, where they would be traveling from, the risk of exposures, the behaviors, and the acceptance that this virus is real. And then when you think about the circulation, maybe change the heating to having continuous circulation or open windows so that you create some additional ventilation. Maybe some of the activities could be outdoors on a patio or on a screen porch. If that's not possible, then having our seating with fewer people at the table. And even when you're seating those smaller groups, if you would think about who you're seating with various risk factors, maybe someone that's returning home from college shouldn't be seated next to someone that is within that high risk category. Maybe we need to now designate someone to serve the food, and where we can stagger the way people are getting their meals. Use single-use towels or paper towels for all hand washing. Set up some sanitizer product in the house.
What are some more things that we should do differently this year?
We would encourage people to keep their list of people, of invitees, small. Social distancing within the house is going to be really important.
And the CDC also released a list of common activities that take place around Thanksgiving weekend. What are some activities that are considered higher risk that should be avoided this year?
Well, certainly going to parades, large groups, avoid them. Some activities that would be a bit more lower risk would be some games, walking, bicycle riding, on scavenger hunts, which really are well designed to keep the groups smaller, but yet keep the festivities lively.
And what about Black Friday shopping? We know that's typically a busy time, but if you're wearing your mask, is that okay, or what do you recommend?
Again, those would be around those large crowds, and we really want to discourage people from getting out into the public like that. So virtual shopping is probably better this year.
Well, finally, what's your takeaway message for people this Thanksgiving and holiday season?
You know, I think Dr. Fauci really made a very profound statement earlier this past week. Don't let perfect be the enemy of good. The things that we can do are really very simple. Wear a mask, social distance, hand wash, hand wash, hand wash, and be smart about the activities, and we can all then enjoy a happy and non-super spreader event.
Well, thank you so much again, Dr. Bose, for joining us.
Thank you, Lindsay. Appreciate it.
Well, if you'd like to find out more about COVID-19, including testing information, visit stlukeskc.org/COVID-19. Next week, we'll be talking to Dr. James O'Keefe about exciting new research in Alzheimer's prevention and the impact of COVID on the heart. If you have any questions for Dr. O'Keefe, you can send us a direct message to our main Facebook page, that's at St. Luke's KC. You can also stay up to date with all of the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.